Now, when we're talking about clinicians in recovery, we're talking about an individual who is in recovery and is in sobriety, as well as simultaneously being a clinician in the alcohol and drug field. Now, there's some thoughts to consider. Two hatters need to continue maintaining their own personal recovery while fulfilling their role as clinicians. Where two hatters get themselves into trouble is where they rely solely on their job to meet their personal recovery needs. That sets them up for burnout. Another problem may be that the temptation to discuss your clients or job with other AA or NA members, Alcoholics Anonymous or Narcotics Anonymous members. This is a serious breach of client confidentiality and can be punitive, monetarily punitive, if that is ever filed or the client ends up finding out and files a claim or liability claim against you and the agency. Another issue that we want to address when we're talking about two hatters, clinicians in recovery, is the topic of clinician impairment and relapse. Now, ideally, the time to address the issue of possible relapse is at the time of hiring. This issue is not solely a concern for the field of alcohol and drug counselors. Other disciplines have impaired clinicians committees. Such professional groups include doctors, nurses, social workers, as well as psychologists. Now keep in mind, every case has to be treated with the utmost discretion and adhere to confidentiality law. Now, the Employees Assistance Program, the EAP, and or their professional association usually work in tandem in handling such a case in dealing with impaired clinicians.